Hi, I'm Mike Koloff. I'm the author of this book, The 55-Minute Natural Fix, and I want to thank you for clicking on the video. This book is about how a very common infection begins with poor diet, weakened immune system, which opens the door for the infection, and that starts a disease process which causes a person to urinate out B6 and zinc very rapidly, which means then you don't have enough B6 to make your neurotransmitters in sufficient quantities, therefore you become very nervous. Now there's other causes of anxiety like low thyroid and a few others, but pyroluria is the most undiagnosed and common and most powerful, I believe, cause of chronic anxiety. Now once a person has chronic anxiety, it must have an expression of some kind. It's like a river in flood. It will overflow the banks. Now you can sandbag it with medications and willpower, positive thinking, behavior therapy, but the most effective relief that you can find is by stopping the disease process that is causing the anxiety to flood over, which in turn causes panic attacks, phobias, ADD, and a number of other problems. Now I've had a lot of these problems, and I noticed that after I got on the therapy that it very quickly reduced the anxiety levels. I no longer have agoraphobia. I can leave the house without any problems. I can even drive to Los Angeles airport 2 hours away and back without the sickening dread that I used to feel when I had to go any long distance. I had my last panic attack in the spring of 2007, and that was mainly because I was slacking off on my therapy. I still have a bit of general anxiety, but it's at much lower levels. I noticed that I no longer have to have acid tablets by my bed each night because my acid reflux just totally disappeared. I no longer suffer from depression. Sometimes it got so very bad that thoughts of self-harm would come to mind. That's a thing of the past. I still get a little bit down, but not like before. I still struggle a bit with insomnia, but that is much better. I no longer have addictive personality, and procrastination is much better. But I still struggle with that. I know that it's made worse by anxiety, but I'm beginning to think it's more like a personality flaw. Now, I admit that this is a lot of information, and it's only natural to be skeptical, but I'd like you to hear me out and take more time to understand. Now, it's a big story, and there's a lot of parts and pieces, none of which is hard to understand, but once you see how they all fit together, it makes a picture which has logic and sense behind it, and is actually more sensible than the theories that you hear on mainstream websites and ads on TV where they say depression is thought to be caused by a chemical imbalance in the brain. Well, when they use the phrase thought to be, that means they can't prove it, and therefore they can't really prove that their drugs work. As a matter of fact, if you Google Newsweek, the depressing truth about antidepressants, you will see that there is serious question whether there are studies which show that their drugs work have really been done honestly. So the more time you take to understand this disease process, the more sense it begins to make, and the less chance you have of missing out on something that could really help you with anxiety problems, or perhaps help someone that you care about. But the most powerful proof that I can give you is the therapy itself, because in about an hour it tends to calm down anxiety if it's caused by pyroluria. So what you need to do is find out if you have pyroluria by looking at a list of symptoms from my website or others. I'll give you a couple of a little head start here. Look at your thumbnail, for example. If you see grooves and lines running the length of your fingernail, you have a zinc deficiency, and the deeper the grooves are, the more severe the deficiency. And if your nail is not rounded but goes in facets, that is even more severe deficiency, and white spots are another indication. Another indication of pyroluria is crowded teeth, because when you have a zinc deficiency from childhood, you tend to have a smaller jaw, and then there's not enough room for the teeth, they become crowded. You don't inherit crooked teeth for the most part from your parents. It's basically diet as a child. And you can confirm this by movies and documentaries from tribal people from the Amazon and the jungles of the Philippines, and tribal people in Africa who have been not introduced to the Western diet. Ethiopians, they have beautiful teeth. And they don't have crooked teeth problem. That's our natural genetic heritage, is to have beautiful teeth. It's only when we have that Western diet that these things begin to happen. And pyroluria, I believe, I know, causes a vitamin B6 and zinc deficiency, and is the easiest explanation for this. Another confirmation you can do by looking up Dr. Weston Price. He did a study on this some number of years ago. But once you feel the therapy begin to work, that was really the way to become a believer. And everything then starts making much more sense, and you see that the theory must be correct. So I'd like you to take some time to look over the website. It's a work in progress. I'll be adding some more videos soon. And see if you have the symptoms of pyroluria. It's a real disease. You can get a urine test for it. I don't recommend it because it's $80 test. Sometimes you get a false negative, and they try to sign you up for more tests, and you wind up spending hundreds of dollars. If you have the anxiety conditions, if you have the physical and other symptoms of pyroluria, you have the disease. And I would suggest that spending the money interrupting and fixing the disease would be better spent. So thank you very much for taking a look, and please check back at the website in the next couple of weeks to see more videos and more information. Thank you.